I recall being 37 and pregnant. I know. I know. I thought it was a good age, right? I had a master's degree. I was employed. I was surprised, but I was prepared. During a pregnancy confirmation appointment, the doctor told my son's father and I that this would be considered a geriatric pregnancy. Listen, the term geriatric threw me for a loop because I had watched enough Golden Girls to have considered myself a Shady Pines expert. At minimum, I could identify a geriatric person, and I was not it. But to make myself feel better, I went down my geriatric checklist, and I confirmed that I did not qualify for a senior citizen's coffee from McDonald's. Okay? I had not received any invitations to join AARP, and, which is the most important, I could still comfortably get up from the couch unassisted. But I was considered geriatric in my pregnancy. Having a geriatric pregnancy taught me the significance of being conscious of the changes that would happen in my body while I was pregnant. With every single pain, I told my provider. I made sure that they were aware. I remember specifically having a conversation about me feeling my son low in my cervix, and they told me that my son was too small to feel that low in my uterus, that everything was fine, that I was okay. Everything was not okay. On April the 21st, 2018, I experienced some spotting and some cramping, and the combination really scared me. So I reached out to my doctor's office by phone and by email, and they told me that I was most likely constipated, that there was nothing to worry about. Then they reminded me that, hey, you have an anatomy scan on Tuesday, so just mention the spotting and the cramping during that appointment. So I made it through the weekend, and I showed up to my appointment on Tuesday as the cutest geriatrically pregnant person that I could muster to be. But during that appointment, they could not find my cervix. Because the truth was, I was in preterm labor, and I had already dilated 1 centimeter. They sent me to UNC Chapel Hill to have a cerclage that would not happen because I was no longer a candidate, because my amniotic sac was hanging in my birth canal. They did not offer me any medication to stop my contractions, but they did offer me their condolences, even though my son's heartbeat was still 153 beats per minute. I remember them placing me in a hospital bed that was not fully operable. Every time they came to examine me, I would have to lift my bottom up and place it on a hard, cold metal bedpan, while the on-rotation doctor used the flashlight from her cell phone so that she could see to examine me better. I called every single person that would handle my son into my room. There was a line of white male doctors around my room and one nurse practitioner. Nobody looked like me. Doctor after doctor told me that my son could not be saved. They said he will have issues. He'll be blind. He'll be deaf. He will be intellectually delayed. And my immediate response was, all of those are worse than him being dead. On April the 25th, 2018, 2,375 days ago, my family and I watched my son Zander die. 2,375 days is a long time to be hurt. It's a long time to feel empty, and it is a long time to hold on to the hopes and the dreams that we had for him that will go unfulfilled on this side of heaven. We held my son in our arms, and we said hello and goodbye. Every dream of ice cream dates, and first day of school pictures died with him. Every bedtime story and every secret cookie recipe died with my son on that day. Easily the worst day of my life. Unfortunately, it is more likely that a woman will lose her life and or her child due to a preventable pregnancy-related complication because she's Black. We live in an existence where I can tell my doctor that I'm experiencing some spotting and some cramping, that I feel my son low in my cervix, and without medical examination, they can tell me that I'm likely constipated when I was actually in preterm labor. Or when the receptionist at my OB's office can look at me as a first-time patient and say, "Oh, you're using Medicaid today, right?" Instead of just asking me for my insurance card. We live in a time where my white doctor can change my due date by 10 days, which meant that we would have to watch my son die because that change threw him into a non-viable category because my doctor was uneducated that the reason that my son measured small was because Black women have smaller babies because of the weathering of our uteruses. We must be responsible for my Black nurse looking at my son and announcing to my birth team that he is much larger than we anticipated. Should I call the NICU? And the white on-call physician looked at my son and simply said no and walked out of the room, never to return. We must be responsible for the lead nurse practitioner looking at me and saying, "I know that you want to be a mother, but trying to save your son's life is not the way to do it." We desire to live in a country that does not see race first. We want to live in that dream that Dr. Martin Luther King talked about so many years ago. However, we see through a medical lens that was created by J. Marion Sims right over in Montgomery, Alabama at a slave hospital. He created an ecosystem of gynecological brutality. He made the mismanagement of Black women the status quo. If you are not familiar with him, he is easily the Freddie, the Jason, the Michael Myers of his time. He made it acceptable for medical professionals to believe that Black people had thicker skin and that we had a higher tolerance for pain. He made mention in his biography, which he wrote himself, called The Story of My Life. He mentioned Lucy, an enslaved woman. He said Lucy had an experimental surgery that she bore on her knees with no anesthesia in the midst of over a dozen male doctors. Then he said she did it heroically. She did it heroically. J. Marion Sims is responsible for conducting multiple surgeries on many enslaved women without anesthesia and also without consent. He set the precedent in obstetrics and gynecology that the color of a birthing person's skin would determine their standard of care whenever they needed a medical intervention. Why? Is a question that I am asked all the time. Why did this happen to you? Why is this happening to other Black women? Statistically, my story is not unfamiliar. According to the CDC, in a medically advanced and well-equipped country, that Black women will lose their lives and or the lives of their children 2 to 3 times more often than our white counterparts. Milken Institute says that Alabama is the heart of the maternal health crisis. I grew up in Mobile County, Alabama, in a city, a small town called Mount Vernon, Alabama, a rural town. When I was growing up, the closest hospital to have a baby was about 40 minutes away. Right. Out of 67 counties in Alabama, 55 of those counties are rural. 16 of those rural communities have access to a labor and delivery unit. What that means for us is that we had better access in the 80s and the 90s to a hospital with a labor and delivery unit. According to the 2023 March of Dimes report card, over 50% of this country produces below average birth outcomes. Alabama is an F. So how can we fix this? How? We must simply allow hope and action to meet at the same place to be better acquainted. Right? And just like the statutes of J. Marion Sims are being taken down, we must tear down our own biases that provoke us to believe that Black pregnant women exaggerate their pain and that they're dramatic. We must be the remedy every single day. We must treat people the way that we want to be treated. We must love our neighbor as we love ourselves. And we must accept that Black people are no longer property or interchangeable parts, but we are people that deserve to walk out of the hospital with our partners and raise our children. I'm soliciting your help. I need your help to keep us alive. And I need you to do that by educating yourself on the disparities in Black maternal health. I need you to advocate for policies that discuss the disparities in healthcare access and quality, and that address structural racism. I need for you to support and invest in community-based organizations that provide culturally competent care, such as Black doula services and midwifery services. And lastly, I need for you to take our concerns seriously. Please do not turn a blind eye to behavior that could result in our deaths. Black women are no longer looking for allies. We are looking for accomplices. We're looking for accomplices. We can no longer depend on the desire for equity. We are demanding action now to help keep us alive. There is a mandate for change, and that change can start here with you. So I am inviting you to be my accomplice and help me save Black mamas and babies. Thank you.